Welcome to this video on the National Animal Disease Control Program, an initiative focused on ensuring a disease-free livestock sector in India. In this video, we will explore the key components of the program, from its objectives and vaccination strategies to its impact on livestock health and infrastructure support. We begin with an introduction to the National Animal Disease Control Program, detailing its background and importance. Livestock are central to India's rural economy. However, diseases like foot and mouth disease and brucellosis pose significant challenges, leading to major productivity losses and trade restrictions. Launched in 2019, this program aims to eradicate FMD and brucellosis. Key targets include achieving 100% vaccination coverage for FMD twice a year and a one-time vaccination for female calves against brucellosis. Foot and mouth disease is highly contagious and affects livestock growth and milk production. Brucellosis, a bacterial reproductive disease, causes fertility issues and milk loss, both of which are controlled through targeted vaccination. Next, we examine the vaccination strategies and the extensive coverage efforts implemented across the country. The FMD campaign utilizes biannual mass vaccinations for all susceptible livestock. Additionally, there is a special focus on reaching migratory sheep and goats in northern states to prevent widespread outbreaks. For brucellosis, the strategy focuses on vaccinating female bovine calves between 4 and 8 months of age. This approach has proven effective, with immunity rates over 70% significantly reducing disease incidence. Effective logistics are vital. Cold storage and centralized purchasing infrastructure ensure vaccine quality and timely distribution across all regions. Moving on to disease surveillance and monitoring, which are crucial for maintaining a healthy livestock population. The program utilizes longitudinal monitoring and regular antibody prevalence assessments to track immunity levels and disease exposure, guiding necessary program adjustments. Digital data integration is achieved through the Bharat Pashudhan Portal, which registers over 39 crore livestock. This data-driven approach supports evidence-based decision-making and real-time tracking. Outbreak investigation includes precise virus typing to ensure vaccine matching. Additionally, regulated animal movement through quarantine and checkpoints helps limit the spread of infections. These combined efforts in vaccination, logistics, and surveillance ultimately create a significant positive impact on the health and productivity of India's livestock. The program has achieved notable results. FMD outbreaks have seen a sharp decline from 132 in 2019 to just 40 in 2025, while brucellosis cases have also dropped, highlighting the success of these control measures. Immunity levels in livestock have shown significant improvement. Herd immunity now exceeds 70% for major FMD serotypes, and high antibody development in vaccinated calves confirms the effectiveness of the immunization strategy. Enhanced livestock health has led to clear productivity gains. Milk yields have risen significantly, contributing to a 69.4% increase in milk production from 2014-15 to 2024-25, directly boosting farmer incomes. To sustain this progress, the program invests heavily in institutional and infrastructure support, ensuring that veterinary services remain robust and accessible. Research and development form a core pillar. ICAR institutions conduct vital vaccine research and surveillance, while scientific disease modeling and sampling ensure that control measures are targeted and highly effective. Veterinary services have been greatly strengthened. Over 4,000 mobile veterinary units now provide doorstep care to millions of farmers, while ongoing investments in facilities and staff capacity building further enhance the reach of these services. Public-private partnerships play a strategic role, offering financial support to boost domestic vaccine manufacturing and upgrading cold chain logistics to maintain the potency of vaccines during transport. Engagement with farmers is essential for long-term success. The program prioritizes outreach and educational initiatives to ensure widespread adoption of best practices. The MAITRI's program trains local technicians to deliver critical veterinary services and awareness directly to villages, while large-scale public campaigns educate farmers on the long-term benefits of disease prevention. Digital tools bridge the gap further. Toll-free helplines provide immediate veterinary advice, and mobile applications simplify livestock registration and vaccination tracking for participating farmers. Driving behavioral change is a key focus. By fostering community cooperation and providing appropriate remuneration and incentives, the program encourages vaccinators and farmers to maintain active participation. Looking ahead, the program emphasizes a, quote, One Health approach, ensuring pandemic preparedness and stronger integration across human, animal, and environmental health sectors. This holistic strategy aligns ministries to unify disease control efforts, effectively reducing the risks of zoonotic diseases and promoting sustainable health for both the country's population and its livestock. Supported by a $25 million United States pandemic fund project and international partnerships with organizations like the FAO and the World Bank, India continues to enhance its surveillance, lab infrastructure, and rapid response capabilities. Finally, standardized veterinary treatment guidelines and comprehensive crisis management plans provide the operational framework needed to ensure rapid, effective responses to any future disease outbreaks. Moving on to our future directions and priorities, we look at how advanced technology will continue to shape the future of animal disease control in India. We are integrating advanced surveillance, including AI-enabled analytics for early detection and genomic monitoring, to quickly identify emerging disease threats, ensuring proactive protection for our livestock. Our strategic priorities also include aligning with international standards for disease-free zones to boost global trade, alongside ongoing capacity building to strengthen our diagnostic infrastructure. We remain committed to an integrated health framework and climate-resilient systems, ensuring sustained investment and policy support to keep our livestock sector thriving and adaptive. Thank you for joining us in reviewing the progress and future outlook of the National Animal Disease Control Program. Together, we are building a healthier and more prosperous livestock sector.